Report coming out of KNH. And the Kenyatta National Hospital is the oldest hospital in Kenya. It is the largest referral facility, not just in Kenya, but in the region too. However, KNH has been in the news lately for all the wrong reasons, from rape claims to child theft cartels. What exactly ails KNH? Doctors and managers of many hospitals in Nairobi admit that what is giving KNH the ulcers is the collapse of the Kenyan hospital referral system. Most of the people rushing to KNH for services should not even be going there in the first place. Here's a report filed earlier by our medical correspondent, Dr. Masi Korir.
In the wake of the recent sexual harassment allegations against the Kenyatta National Hospital, many questions have arisen as to what could be the cause. Is the Kenyatta National Hospital the problem, or is it a victim of a failed public health system, or is this a symptom of a bigger problem, like a sick and malfunctioning public health referral system?
The biggest challenge we have is a collapsed referral system in this country.
Felicitas Musyoka, the Nairobi City County Referrals Coordinator, explains how the 85 primary level facilities across Nairobi are linked to its 4 county referral facilities, namely Mama Lucy Kibaki, Mbagathi, Mutuini and Pumwani maternity hospitals.
Each sub-county has a committee which manages their referrals in that sub-county. Patients refer themselves. They can decide to refer themselves from the community to Kenyatta National Hospital because they think that is where they can get the services.
The concept of the referral structure is still not well understood. Here at Mama Lucy Kibaki Hospital, Nairobi City County's referral facility, patients come for different reasons. Some are self-referrals from home and others are referrals from the lower level facilities.
The ones who come from home, those patients maybe had sudden illness like bleeding, others had maybe assaults at home, and others had gradual illness like the hypertensive patient, diabetic patients, they'll come and be seen here.
Tulikuwa tunaenda St. Mary's huko Lang'ata. Sasa wakatuambia tukuje kwa National Hospital, Government Hospital.
Nimekuja, mtoto aliumia kidole, ikakatika kucha, ilikuwa karibu kuanguka, lakini nilipokuja akatibiwa, kashonwa vizuri, sasa anaendelea vizuri.
Nina makadara wakanituma hapa, lakini tangu nikucha hapa naona mtoto anaendelea vizuri.
Tulianza kwa hospitali nyingine, tukaanza kwenda Mathare North, kwa maana tumetoka upande wa Dandora Phase 1. Sasa ambapo hao ndio waliweza kututuma pande hii.
The patient comes from the catchment area. There's Dandora, Kayole, Umoja, Kasarani, Mwiki, Ruai, all those areas surrounding.
For such a population, Mama Lucy Kibaki Hospital and its 121-bed capacity is inadequate. Additionally, the hospital lacks critical care facilities like an ICU, and this building earmarked for that is yet to be completed 5 years later.
The counties need to ensure that their level 5 hospitals have functional laboratories, have functional X-ray departments, and have fully stocked pharmacies.
The referral system in the country is composed of level 1 facilities, which are the community units, the level 2 and 3 primary care facilities, which are dispensaries and health centers respectively, level 4 and 5 facilities, which are county referral hospitals, and finally the level 6 facilities, which are the national referral hospitals, where the Kenyatta National Hospital falls.
It's only upward referral, there's not downward referral.
Upon discharge from the facility, though, things may be different.
We discharge you to go to the nearest place close to where you come from.
An example of such lower-level facilities is Lang'ata Health Center.
We have 2 categories. We have self-referrals and we also have others who are referred from other facilities.
Irene Bosibori travels all the way from Ongata Rongai for all outpatient and maternity services, all offered at this facility. Any person that they cannot manage is either referred to Kenyatta or Mbagathi hospitals.
KNH, when this was designed, it was meant to handle around 1,200 patients per day. Today, volumes are high.
Lack of doctors, nurses and other healthcare personnel in health facilities, in addition to inadequate equipment, cannot be ignored. Nairobi City County, for example, has 18 ambulances, of which only 5 have basic life support. As a result, Kenyans look to Kenyatta National Hospital for help.
If these facilities were functional to capacity, then patients, when they get trauma, they be going direct to Mbagathi or Mama Lucy before coming to Kenyatta National Hospital.
While Kenyatta National Hospital continues shouldering the burden of a growing population, lower-level facilities like this Langata Health Center remain underutilized. More, therefore, needs to be done to decongest Kenya's biggest national referral facility. Dr. Mercy Korir, KTN News from Langata, Nairobi City County.
Thank you, Dr. Mercy Korir, for that report. And online, I have yet another doctor. Dr. Oma Oluga is the Secretary General and CEO of KMPDU. Good morning, Daktari. Let me begin our conversation this morning from, of course, KNH. We're going to talk about the strike notice shortly. But let's begin from the biggest or largest referral hospital in Kenya, that is KNH. We've seen rape allegations there a while ago. We've seen, cases of child theft. And now doctors operating on a wrong patient. What does this say about this facility?
Thank you very much, Yusuf. Indeed, we need to have a lot of discussions about our whole healthcare system, not just Kenyatta National Hospital. But I think I want to say that there are a lot of good things happening in Kenyatta as equal to the, to the unfortunate incidents that we are also experiencing. I think NH has been on the news quite a bit for not very pleasant news. But also it has been there for good things. Recently we had the hand reimplant that I think was also lauded in equal measure. We had Siamese twins, and a lot of good things are happening. But I think generally there are a lot of issues with how we manage our healthcare system. And let me just go specifically to this issue about the wrong patient wheeled to theater. These are quality management system issues. It's not, I had in the introduction, it's being blamed on either commitment or competence. I think it has nothing to do with that. And I think any Kenyan or it's very unfortunate. I think we have to say that these are very unfortunate incidents in hospitals and should be minimized or eliminated completely. But it happens almost everywhere in the world. This is not the first case.
So this is not unique to KNH. I think you've delivered your point there. And there's one viewer here, Dr. Purity Ngigu, says man is to error, but in a hospital, there's no room for that error. That is life you are dealing with. And these are doctors under your union, perhaps. What are you planning? What are you planning to do about it?
There's very little room for error. We have already given our own proposal to the CEO of Kenyatta on a way in which we can work on quality improvement. There are a lot of quality improvement initiatives that we have proposed. And I think, first of all, let me just also say that Kenyatta is using a hammer to treat something that shouldn't. It's a quality system issue. So I think suspending staff does not solve the quality system issue. Today, there will be 2,000 patients still coming to Kenyatta. So if Kenyatta does not have labels for patients, then they have not solved the problem. So that is the most important thing. So whether you suspend all the neurosurgeons, you suspend all the nurses, if patients coming to casualty, when they come with the ambulances, because county hospitals are also not functional. Yesterday alone, I witnessed 15 ambulances from 15 counties that brought in patients. So if those patients are still not going to be labeled, if those patients are still not going to be tracked, if the patient flow is not going to be taken seriously, then whether you suspend all the staff, then you have not solved the problem. So I think our advice to our good friend, the Lily Koros, is that I think what she's done is sort of reacting to public pressure, which is the competency of the staff that are seeing these patients. And number 3 is exactly issues of indication and diagnosis. But like in this case, if a patient is labeled wrongly, so the patient was labeled wrongly in the first place, and sometimes when doctors are operating in the theater, I'm very familiar with Kenyatta National Hospital, then they are too busy because you find that the theater list has sometimes 19 people. And so you really rely on the other staff on the floor, which are in the wards, to get you the correct patient. Because when these patients come, they are also not talking to you. You cannot confirm. So once the label is there, you have said this patient is called Umauluga, then I as a doctor, I may not have much procedures to really confirm. So that's why I'm saying these are quality system issues. And I think quality system issues should not be labeled on staff. I know it's very unfortunate, and I know that it is something that we must condemn. And again, it is not unique to Kenyatta National Hospital. So many other hospitals, if you go to like private hospitals, you find they give you a tag on your wrist. So I think those are the things, simple things that make a big difference that Kenyatta should introduce than this public reaction, no, we have suspended so and so. I think it doesn't cut. I think they're just trying to create animosity. Doctors and nurses, they do a very good job. 3 things that Kenyatta must do: tag patients, improve teamwork, and quality assurance, and the way patients are tracked.
One final question about KNH, Dr. Mo. We're going to talk about the strike notice shortly. Is it true, you've already said you're familiar with that hospital, is it true, because we're getting reports that more than 80 surgeries are conducted in a single day at that facility. Does it mean, as you confirmed that for us, does it mean that doctors, nurses there, health practitioners basically are overwhelmed?
People are really overwhelmed in Kenyatta. I can tell you for sure, if you're looking at departments, first of all, theater space is not enough. So there's always, this one comes in, that one goes out. Because you find that if they don't do that, then the casualty, which is the A&E, ambulances still keep coming in. So they will also not decongest casualty if they don't do those operations the manner it is. So the patients, Kenyatta National Hospital only has 264 doctors, like the ones that are employed by the hospital. Then there is the other bit that are from the University of Nairobi, which provides the bulk of services also, in addition to the Kenyatta staff. And if you look at the nursing force, doctors force, there's a very huge shortage. So doctors are overwhelmed. You find one doctor could be doing up to 19 or sometimes 10 to 19 operations, depending on the kind of operations. In complex operations like urology, transplants, or even neurosurgery, they get up to 3. And one operation could take up to 8 hours. So you can you can see the amount of fatigue there, and therefore you really rely on a quality system to ensure that the right patient is brought with the right diagnosis, with the right laboratory. And we see this also in the errors. Sometimes we see wrong results, for example. You find, because of quality issues. So these are things that need to be improved, and I think the direction that I know it is in the news and that people are saying, oh, doctors have been suspended. I think it's the wrong prescription for the problem, and I think it's something that is just it works to demoralize the doctors and to demoralize the nurses that are really working so hard. And I think it's something we'll advise against.
Yes, Dr. I understand some of the issues you've raised have been the subject of, several strikes by the doctors. And speaking about the strike, I understand you have issued a 14-day strike notice for specialized doctors. And as much as you're going to tell us more about that, what does this say about the status of health in this country? Is it being given the attention it deserves?
Well, yesterday I was on KTN and I was saying that we signed the CBA as the KMPDU, and what we need is now emphasis on implementation of that CBA, because all these issues had been thrashed out and we had agreed upon them, and there are laid down procedures, including formation of committees to look at all of these issues. And I think what we would want to appeal for from the government is that these committees be made functional, so that then there is a dialogue mechanism. In the issue of the strike, the UASU, which is the lecturers, and also ourselves as KMPDU, backed up to begin an industrial action yesterday. For us, it's simply because of the doctors who work at universities, who are lecturers. So last year when we engaged the government, we had agreed with the government that there will be enhancement of salaries across all doctors, for all the doctors in the public sector, including universities. So the counties implemented, the Ministry of Health implemented, the parastatals implemented, including Kenyatta and MTRH, they implemented, but the universities have not implemented 1 year down the line. So they owe the doctors a lot of money in arrears, and they also owe the doctors implementation of that salary. And we have engaged with the university councils. We have engaged with the Ministry of Education. We have even engaged again with the Ministry of Health. And I think the new cabinet secretary has shown, she showed a lot of goodwill by saying that even though the issue does not concern her, she will take necessary measures because then it affects her sector. Kenyatta National Hospital is a threat, MTRH is a threat, the referral hospitals are a threat. So the strike began yesterday, and for us as a union, we endorsed the strike by lecturers because you can't wait over 1 year talking about something that has already been discussed and ended. We already signed our return to our formula. We already signed our CBA. What remains is just implementation so that these lecturers can be paid their money. They have waited for over 1 year. I think it is not true that the universities do not have money. There's a little bit of confusion between the universities themselves, and the universities are not adequately engaging with the Ministry of Education, and the Ministry of Education is not giving the right attention to medical schools where there are over 605 lecturers who are doctors who also deserve to be paid at par with their colleagues in the public sector.
Yes.
So this is the angle to which we are coming. The WASU on the other side are looking for a CBA, their CBA 2017-2021, and some of these issues are merging together. So you can see the strike is just affecting the universities only. So the other members of KMPD who are working at county hospitals and Ministry of Health are not on strike, and they should be on duty. But the university staff who are doctors and who are members of KMPDU, because also the lecturers are actually on strike, are participating in the industrial action so that their issue of allowances are sorted out. So that is exactly the clear picture. And as we are willing to engage, as I mentioned, the Ministry of Health showed some goodwill with the new cabinet secretary, and we are hoping that the Cabinet Secretary for Education, Amina, could also show that goodwill. Call us today. It's a very simple issue, by the way. It should not even cause an industrial action. It's very unnecessary. This is simply lack of dialogue. That is.
Of course, it's every Kenya's hope.